So welcome everybody. Thank you for coming. My name is Kelly Gluckman. This is a weekly ongoing series on topics regarding HIV, HIV basics. This is brought to you by brightbod.com. These presentations are not intended to be used as medical advice. I'm not a doctor. In fact, my advice is normally to go to a doctor, but just keep that in mind. We're silencing all the microphones for about 20 to 25 minutes while I do my presentation. And afterward, I'm going to open up the floor for questions. Feel free to ask any and all questions. I'm happy to answer everything. I hope you have like a pad of paper near you to write down questions as I go, just in case, so that you don't forget. Also, if you have questions after that I didn't answer, feel free to go to brightbod.com and to video record yourself asking a question, and then someone will go back through and answer it for you. So today I'm going to be about getting tested for HIV. I usually do a little overview. So I'm going to start with story time as usual. I talk about my personal experience with, whatever I'm talking about today. It's getting tested. We're going to talk about what the different kinds of HIV tests are and what they do. We're going to talk about the HIV window period, how often you should get tested, and where to go to get tested, resources for HIV testing. So that's me. And my ex. I covered his face for privacy purposes. That picture is of me probably right as I contracted HIV. I've been HIV positive for 6 years. So my boyfriend and I, my boyfriend pictured with a silly face over his face, he and I decided to stop using condoms without getting tested first. And I knew that that was a silly decision. I had received comprehensive sexual health education when I was in high school, and it was drilled into me to go get tested frequently, get tested with your partner before you stop using protection. And with him, he and I were laying down and cuddling one night, one day. It was actually afternoon. And we wanted to have sex, but we didn't have a condom. And so I had been tested just 2 weeks before he and I started dating. And I asked him when the last time was that he got tested. And he was like, oh, it's been a couple years, but, so-and-so and so-and-so were both tested and they're both totally fine. And he and I had been friends for a year and a half before we started dating. And I knew both of the girls that he was talking about, those two girls being the last girls that he had slept with. So I was like, okay. So we stopped using condoms, and about 6 months went by, and I was like, you know what, we should go get tested. We should just make sure that everything's okay. So we went to Planned Parenthood, and I expected to walk out with a clean bill of health and to be able to just go on my way. And that day, he and I both tested positive at the same time. And I'll talk about which methods they used to test us a little bit later. So the HIV tests themselves. Most HIV tests are designed to detect antibodies, which are produced by your immune system when you're exposed to the HIV virus. These tests look for antibodies in your blood or oral fluid. So when HIV enters your body, your immune response is to create antibodies specific to HIV. So any test, most tests that you get initially to get tested for HIV are going to test for these antibodies and not necessarily the virus themselves. They're very accurate, even though they're not looking for the actual virus, because these antibodies, like I said, are specific to HIV. And I know what you're thinking. Oral fluid, I thought you couldn't pass HIV through kissing. Um, what we're talking about is not saliva. We're talking about oral mucosal transitate, which only enters the mouth by crossing the inner lining of the cheek from the capillaries. So when you do these tests, if they test your oral fluid, they're going to be like going into your gums or kind of like roughing up your cheeks a bit in order to get what they need in order to test you. So it's not saliva, it's a little bit deeper than that. Again, HIV cannot be passed through saliva. Oral fluids contain both pathogens and antibodies. Pathogens meaning viruses, bacteria, etc. Antibody tests are very accurate. However, if your antibody test comes back positive, they will do a follow-up test just to confirm. The follow-up tests are more expensive and more sensitive. That's why they don't use them in the first place, because they're more expensive. They detect both antibodies and antigens, which is part of the virus itself. So that is what an oral HIV test looks like. You can see she's like getting up into her gums. You can actually get those at the pharmacy and take them home. They're pretty darn accurate. This is the Western blot test. These tests do test for antibodies, but they prick your finger and they put it on that little dot on the bottom left corner. That's the test that they used for me when I first went in. They took blood from my finger and they put it on. It almost looks like a pregnancy test. But that's the results for both of these tests come back within 15 to 30 minutes. And beyond that, if you're going for a full STD or STI panel where they test for chlamydia, gonorrhea, syphilis, and HIV, they're going to take your blood as well. If you're only going for HIV, if you're going for an HIV specific test, they'll do the oral or the Western blot, which is the finger prick that you see. But they will do blood tests regardless of whether you test positive or not for the oral and the Western blot, if you're going in for a full STD panel. So when I went into Planned Parenthood, they did both the Western blot and they drew blood from my arm, because I was testing for everything at the time. The HIV window period, it's an amount of time after a person is first exposed to the HIV virus where they are capable of passing the virus to another person, but they may still test HIV negative. So the HIV window period is really interesting because you happen to be more contagious during this window period. However, you might get a false negative. I did some reading on it, and I'm not going to talk much more about it because I'm still like not 100% on the window period, but there is a chunk of time where an antibody test will test negative. The soonest an antibody test will detect infection is 3 weeks. Most, but not all people will develop detectable antibodies within 3 to 12 weeks of infection. So I got that information directly from the CDC website. Like when you first get infected to about 3 weeks is a window period where you may test HIV negative. And here's kind of an explanation of it. And each test is different. Like if you look on the bottom from day 9 to 14, it says HIV viral load can be detected, HIV RNA test can be taken. So an HIV RNA test is a very expensive test that they don't normally, what's the word I'm looking for? They don't normally give you those tests just because they're so expensive. So if you go in for just a normal HIV STI screening, they're not going to initially do that because they don't deem it necessary. If you go in with almost kind of like an emergency, you've been exposed, you know that you've had sex with someone who has HIV, or you used a needle with someone who, like if there's an emergency, they'll do one of those tests, but not under normal circumstances. At day 16, the P24 can be detected, so that's an antibody test. That's a very, I think that's a combination antibody and antigen test. And then down at day 28, the 4th generation antigen antibody test can detect HIV infection. So these are just the different points of time where certain tests will be able to accurately detect HIV. The window period is kind of fascinating to me. I want to do more reading on it personally, but just know that it exists at this point. So how often should I get tested? Take honest personal inventory of your behavior. Look at yourself and think about what you do. And general guidelines state that if you're sexually active, getting tested every 6 months to a year is wise. And do it even if you are in a committed relationship. A little bit more story time. So my boyfriend, I found out a month after diagnosis that my boyfriend had cheated on me, and that he had lied to me about how many people he had slept with before we were dating, and who he was sleeping with as well. My ex-boyfriend was sleeping with men, and he didn't feel comfortable telling me. I would have loved him regardless, but it just goes to show you that anything can happen in life. Even if you're in a committed relationship, it's wise to get tested. So ladies, if you're going in for a pap smear, ask to get an STD and HIV workup. It's usually free under insurance plans. And it's just a great way to know your status and to be able to take care of things. Because if something comes up positive, you want to get on top of it as quickly as possible. Okay. So lower your risk factors. Use condoms. Woo! Use condoms. I thought that was adorable and hilarious. If for some reason you find it difficult or impossible to use condoms, get to a doctor and talk to them about PrEP and or long-term birth control options. Even like if you just don't want to use condoms, there are options. I'm not in the business of judging anybody's behavior. I'm just here to give information. So PrEP is a new prevention method in which people who do not have an HIV infection take a pill twice a day to reduce their risk of becoming infected. I've talked about PrEP a few times in my other webinars, but PrEP is extremely effective in preventing HIV. It doesn't prevent other STIs though. So if you are taking PrEP, or if you get on PrEP, you're still going to want to be tested for STIs and also HIV, because life happens. And contraceptive methods. There are so many different contraceptive methods, and you can find one that's right for you. I personally have an IUD. So also, if you're using drugs, seek out a syringe exchange program in your area if that doesn't exist, and if you're not ready to quit, take measures to make sure the needles that you use are disinfected before you use them. You can go to Google and type in syringe exchange program in your area. Syringe exchange programs offer to change your dirty needles for clean and sterilized needles so that you're protecting yourself. We've figured out that preventing HIV infections is a lot less expensive than treating HIV infections. So syringe exchange programs are excellent ways of reducing risk, and they exist in a lot of places in the US. So if you are using drugs, if you're having trouble quitting, if you don't really care to quit, there are ways to protect yourself, and that is one of them. If you're getting a tattoo, watch your artist while they're setting up, and ask about their sterilization process. That picture is a really, really nice setup for tattoos. I know someone who went to Tijuana and got a tattoo with his friend, and his friend was HIV positive and he didn't know it. And so his friend got a tattoo, and the person used the same needle that he used on his friend on him. And he was married with his wife, and he had no idea that happened. He had no idea that his friend was HIV positive. He didn't realize that he put himself at risk. And so years and years and years went by, and he was infected with HIV, and he actually developed symptoms of AIDS. And that's when he was diagnosed with HIV. So it's very, very rare that someone gets HIV through a tattoo, but it is a risk that exists, and it's so easy to avoid. So resources for HIV testing. Planned Parenthood is probably number one in the nation, and it's also one of the biggest in the nation. I'm a huge advocate for Planned Parenthood. I love them. That's where I got tested. They were amazing with me after I got tested, and they kind of saved me through my early adulthood. Google is your friend. Type into Google free HIV testing in your city. I know in just about every city there's going to be free HIV testing. It's free, it's anonymous, and the people who are testing you will be able to point you in the right direction if you happen to test positive. Go to your local pharmacy. Like I said, they have at-home HIV oral antibody tests for you to purchase and administer in the privacy of your own home. That's a great way to go. One downside of doing an oral HIV test at your home is that you don't have the guidance of a professional. When you're getting tested at a clinic or by someone who's trained, you have someone to talk to immediately and right away. Of course, you've found Brightbot and you've found this, so chances are you know how to use the internet, but it's still like it's very isolating testing positive at your house. So that's one downside to testing at home. Okay. And I've reached the end. This is, as usual, these are my social media outlets. On Facebook, add the one with this picture because that one is the best way to get a hold of me. That's my professional Facebook, and I answer messages. I comment back. I am responsive. I'm happy to engage. So yeah, I'll open the floor up for some questions.
Kelly?
Yes.
Prior to your, when you said the first time you tested positive, prior to that, leading up to that, did you notice any changes in your, did you feel any different in your body at all, or? No?
I get that question all the time. No. I didn't have any changes whatsoever. I didn't get sick. I just knew that I made a stupid decision having sex without a condom with someone who I hadn't been tested with before. Yeah. No, I didn't have any physical symptoms. Very, very common question.
Okay. And something I just thought of while you were talking about getting tested. Would you have an idea whether those Doc in a Box places, the Walgreens, the CVS places that you go for flu tests, for flu shots and things, do you have any idea if they do that kind of stuff? Just curious. Have you ever heard about?
That's a good question. I don't know. You would think that they would,
They seem to be doing everything now, so.
Right. Yeah, I mean, where do you live?
Me? I live in Florida, Tampa.
Oh, Tampa, okay. Man, I talk to so many people from Tampa, Florida. It's crazy. I feel like I need to go visit Tampa, Florida. I have two great guy friends who live there. The guy who runs this website is in Miami. My uncle is in Fort Myers. Florida's been calling me. Anyways,
You should.
yeah, it's crazy. So, like if you pay attention now, and like walking around, if you're going through like a part of town that has a bunch of bars, you might see trucks that say free HIV testing on it. Free HIV test trucks like to inhabit highly populated areas, and especially like areas that people are partying in. So you might see trucks around there. And like in LA, there's a store called Out of the Closet that does free testing. There are like a bunch of thrift stores that double as nonprofits. So you might have that in Tampa. If you Google free HIV testing in Tampa, I'm sure you'll be able to find a bunch of stuff.
Okay.
Yeah.
Thank you.
No
Kelly,
problem.
when you found out he was having sexual intercourse with men,
Yes.
how did you feel?
I felt awful. I mean, that honestly, that was the hardest part of my journey for me, because when I was first tested, it was like he and I against the world. And I found out from one of the guys that he cheated on me with that he had cheated on me and that he was sleeping with men. And to me, it's betrayal and broken trust. And like I was in the Gay Straight Alliance in high school. I love the gay community. I'm an active ally of the gay community, and he knew that. So it was like, why wouldn't he tell me? You know, and like there was no indicator. Like all I had to do was take off my shirt, and the guy was hard. At risk of sounding vulgar. But yeah, it was less about him sleeping with men than it was about him lying and withholding a big chunk of his identity from me. And I asked him, well, I stayed with him for about 9 months after I found out that he cheated on me with a man. And that he told me that he slept with at least 12 guys in the year before we started dating. He was very confused. He was very lost. He's very reckless. And I asked him why he didn't tell me. And he said that he was afraid that I wasn't going to love him anymore. He was afraid that I wasn't going to want to be with him. And he doesn't identify as gay, or bisexual. He identifies as heterosexual. And it speaks to a bigger societal problem, in my personal opinion, that, you know, if you can't be who you are and like what you like and be able to own it, then it causes reasons to be, like in your own mind, reasons to be dishonest and withhold things from people for fear of judgment. So yeah, no, it felt awful, and it made me angry at society. Over time, I've become, I forgave him immediately. I was more pissed off at society for creating this environment where the man that I loved couldn't be who he was with me. But it was devastating. It was absolutely devastating.
That was very selfish and reckless on his part.
Yeah, it was very reckless. It was very selfish and reckless. Yeah. I at one point I looked at him. I'm way too nice. I'm way too nice. I looked at him. I'm like I'm going to sound like a bitch, and I know that, but like, are you stupid? he was very apologetic. He was like, "Yeah, I guess I'm stupid." I'm like, "Yeah, you're stupid." He just, I don't know. I don't think I'll ever truly understand. But yeah, reckless and selfish for sure.
Kelly,
Yes.
you said something about you got tested before you stopped using the condom?
Yeah. I got tested before he and I started having sex. So 2 weeks before he and I got together as boyfriend and girlfriend, I had been tested for HIV and all other STIs.
Or you went ahead and got tested before?
Yes.
And the reason for that was because you were sexually active, or you were?
Yeah. I always. Wait, say the last part again.
For people that are sexually active, that is the way to go. That you just randomly get tested.
Yeah. Every 6 months to a year, you should be getting tested if you are having sex. I was using condoms, but even so, I still got tested because that's just what you do. And that's what I was taught.
It's a safety measure.
Yes.
Okay.
Kelly, you said something about contraceptives. Does contraceptives prevent you from contracting AIDS?
No. Contraceptives help you from unwanted pregnancy. So I mentioned contraceptives because I mean that's just a part of sexual health. I'll go back to that slide. Blah, 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 blah. Here it is. Okay. I'll go back to that slide and show you. So use condoms. If for some reason you find it difficult or impossible to use condoms, get to a doctor and talk to them about PrEP and or long-term birth control options. So if you're not going to use condoms as a female who is ovulating, or as a person who is ovulating, talking to your doctor about contraceptives is just as important as getting PrEP, in my opinion, because unwanted pregnancies are not a good time. Whatever you choose to do with it, it's not a good time. So if you're gonna not use condoms, you want to think both about using PrEP and also about not getting pregnant. So that's why I mentioned contraceptives.
Okay.
Kelly, have you heard of any cases whereby someone did the HIV/AIDS test in their home and was alone, and the consequences afterwards was not favorable to them?
I actually don't know anybody who's tested at home. I don't. I just know that the option exists.
Oh, okay. Yeah. I ask because I can see that being, not being in a good situation in case that, the results came back as positive, and not having someone that is educated in that area, to counsel them or at least guide them through that time.
Right.
When they get the results.
Yeah, absolutely. Yeah, that's why I don't necessarily recommend at-home tests, because for that reason exactly. And also, like with oral swabs, it's very specific the way you administer it. So for both of those reasons, it's not something I recommend. It's an option that exists.
Oh, okay.
Yeah.
Thank you.
Yeah.
I have a question.
Yes.
If your ex-boyfriend, who was your boyfriend at the time, was hiding this fact from you that he had unprotected sex with a number of different partners, and at least 12 other partners that he concealed from you, what was your impression of whether or not he felt any relief after getting an HIV test? Do you think it was a good experience for him? I mean, or do you think he regretted getting that information when he got it?
That's a really good question. We didn't really talk about that. He was very quiet after getting tested. We took the elevator down and walked to our car. And I looked at him and I said something like, "Who have you been sleeping with?" And he was just like, I was like, all right, whatever. It doesn't matter. You know, like I let his penis into my vagina without a condom. Like this is my responsibility, whatever. But he was very, very quiet. He was very scared. His face was white. He was petrified. He didn't know what to do. I didn't ask him any more questions at that time. There was some point where I remember this very clearly. There was one point where it was very clear to me who I had gotten it from. In the time where we got diagnosed to the time where I found out that he cheated on me and that he was sleeping with men, he said something like, how do you know it was me who gave it to you? So I think he was in denial. And I think that he doesn't like taking responsibility. It took him a long time to take responsibility. We met up like a couple years ago for coffee, and he looked at me and cried and apologized for all the pain that he's caused. So I initially I think that he was in denial.
If there are other people who ever watch this video and they're concerned that they may be in a situation similar to your ex-boyfriend's, in that they may have contracted HIV, but they're too scared to tell their partners, what would you tell them to do, and as it relates to you?
Are you asking for me to talk about another partner who thinks that their person cheated on them, or?
No, the cheating is incidental. I mean,
or they gave their partner HIV, or vice versa?
Yeah, I mean, if someone's watching this and they're afraid they might have given their partner HIV,
okay.
being in the shoes that you're in now, what would you advise them to do? Should they stay scared and stay silent, or are you grateful for the fact that he finally told you? What are your comments?
I think it's always better to know as quickly as possible so that you can take care of it as quickly as possible. As far as advice, it takes a lot of courage and cojones, it takes a lot of balls to tell your partner that you think you might have given them HIV. I can't imagine being in that situation. But I am glad that I found out as quickly as possible so that I could take care of it and heal, move forward, and live my life. Because if you wait and don't tell your partner, you didn't just give them HIV, you are letting them go for a period of time while the virus is attacking their immune system. You're not just giving them HIV, you're letting them go into AIDS territory. So I feel like it's a moral imperative to, if you think that you have given someone HIV, you need to tell them so that they can take care of their health. I think you have to put yourself aside. You have to put your pride or it's you're fucking with someone's life. I went from really nice to like really pissed off. But yeah, that's how I feel.
Thank you.
I think can you hear me?
Yes.
Okay. You think he's telling his other partners that he's HIV positive?
No, I don't think he is. In the 9 months that I was with him after finding out that he was HIV positive, he did not reach out to a single partner that he had previous to me. I had one of his previous partners, who's a girl, send me a message and say, hey, I heard through the grapevine that you and your boyfriend have HIV. Is that true? Because she had messaged him first and he never responded. And so she reached out to me because he hadn't responded to her. And I said, yeah, that's true. Go get yourself tested. And then I messaged her like a few months later and she didn't respond to me. Yeah. I know. But yeah.
To you, Kelly, that you're quite brave. I only know you from these webinars, but from everything that you have said that you've gone through thus far, I really have to compliment you, for being brave enough and, as you would say, have the gonads to come out here and educate us, and let us know. So I really do appreciate you in the way that you present yourself.
Thank you. I appreciate that. Oh. It's been a tough road, I'm not gonna lie, but I don't know. It's worth it. This is what I'm pursuing. I tell my story publicly, regularly, so that I can help people avoid what I've been through. So it's worth it to me. So I really appreciate it. I feel like you're talking, but I can't hear you.
You'll have the support of your friends and family.
You're asking me if I have. You're asking
if
me.
you still have that support from your family and your close friends.
Yeah, I have lots of support around me. I do. Yeah. All right. We're reaching toward the end. Does anybody have any more questions? Okay. All right. Well, I appreciate everyone's time. I see all the familiar faces, which makes me feel all warm and fuzzy. Thanks, everybody. I hope you have a fantastic Tuesday and a great week, and I'll see everyone next week.